Okay, so now we're going to talk about telenursing and remote access healthcare. So, sorry, objectives. We're going to explore the use of telehealth technology in the nursing practice, identify socioeconomic factors likely to increase the use of telehealth, and describe clinical and non-clinical uses of telehealth. Now, when I first heard about telehealth, I was so irritated. It's just like, you're going to get me out of a job. We're not going to be able to take care of patients well. Um, I think telehealth definitely has a place in healthcare. I'm not sure where, but I'm a lot more open to it. So we're going to touch on it today. All right. We're going to specify and describe the most common telehealth tools used in nursing, explore the pathways and the legal ethical issues, describe the role of telehealth nursing, and apply the foundation of knowledge model to home telehealth. So let's talk. What is telehealth? So this is a relatively new term in our med nursing vocabulary, and it refers to a wide range of health services that are delivered by telecommunication-ready tools such as telephone, video phone, and computers. The growing field of telehealth, particularly in the nursing practice, will allow us to improve care and delivery services. Here's some of the history. I'm not going to get into a ton of it, but in the last 20 or 30 years is really where the advances came. But a long time ago, when the bubonic plague was happening in the Middle Ages, neighbors use bonfires to tell each other about what's going on. And so Craig Patterson was like, wait, we can kind of use this idea to implement a way to improve health. So the National Institute of Mental Health supported a program in the mid-1950s that connected 7 state hospitals in 4 different states through a closed telephone circuit. And then they started using television to monitor patients in a clinical facility in the 50s. And then it just started to become more interactive. So Patterson suggested that ever-evolving technologies and digital transmission, and with the explosion of mobile phones and satellites, that we're going to have an advance in telehealth. So in the 70s, we had a more advanced form of telehealth in the medical field referred to telemedicine, and so that included teleradiology and telepathology. So radiological and pathological images were transmitted to specialists, and we still do that, right? I can read an X-ray like pretty simply, but I'm not a radiologist, so when things need to be read, we send the images to a radiologist that we've contracted with, and they can tell me right then and there what I'm looking at, so that I don't delay care. Another example, breast cancer. So they started sending pathology slides to pathologists, and they were able to identify the type of chemo somebody needed. They used to send out the pathology, and it would take months to come back, and that would delay treatment. So success in telehealth was achieved after decades refining the technology that needed to be clear, image, speedy transmission, and accurate. And of course, you have to protect the patient. And then you also want to ensure that the professional can replicate usual clinical interaction in all the specialties. So nursing telehealth. Okay. Telehealth interventions or contacts are performed off-site, and they require less time spent on tasks because of the efficiency offered by the technology. So some driving force obviously is demographics. If you live somewhere where you don't have enough access, this is going to be an issue. Healthcare working shortages, lots of chronic conditions that need frequent healthcare, new and more educated consumers seeking care, and then excessive cost. I mean, it's expensive. Not that telehealth is free, but even just the cost of the bed. So having this telehealth is supposed to help meet all those needs. So telehealth is also going to help fit with the scarcity. So here's the definition. Telemedicine is the use of medical information exchange from one site to another via electronic communications to improve patients' health status. It's closely associated with telemedicine, and it's often used to encompass the broader definition of remote health care. But it's not always clinical services when you talk about remote health care. There's video conferencing, transmission of still images, e-health, including patient portal, remote monitoring of vital signs, Gosh, even remote monitoring of people's heart rate, continued med ed, nursing call centers, that's all part of telehealth and telemedicine. So store and forward, like digital images, clinical things that are captured and forwarded on, real-time interaction, remote monitoring, and telephony, which is monitoring being via the telephone. We use that all the time, kind of informally. So clinical examples, transmitting images for assessment or diagnosis, transmitting clinical data for assessment, diagnosis, or disease management, like someone calls you every day with your blood glucose and you can adjust their medicine. Providing disease prevention and promotion of good health, such as telephonic case management, or patient education, or online. You can take an online baby course, you can take an online CPR class. Using telephonic health advice in emergent cases, so performing teletriage, using real-time video to give health services or education. I mean, how great would it be? Someone who really doesn't like to leave home or they can't, you could do, online diabetes classes. So real-time clinical health is when it's happening in the moment. So telemental health is really great because there's not enough mental health workers, and that is a great way to get a bunch of people in with a mental health specialist. They have tele-rehab, tele-home care, teleconsultations, hospice, and palliative care. So let's talk about telenursing. This refers to the use of telecommunication and information technology for providing nursing services and healthcare to enhance care whenever a physical distance exists between patients and nurse or between any of the nurses. So I'm going to give you a little video on telenursing.
At the Christ College of Nursing and Health Sciences, we know the goal of your education is a great career. Get connected to guaranteed.
There are so many services, products, and gadgets on telehealth and telemedicine today that it can be very confusing, hard to find, and impossible to know where to start. Furthermore, language barriers, physical impediments, time management restraints, or limited access to transportation can often deter many individuals from going to the doctor. As a consumer, how do you know the quality of these services? Because of their fancy ad, their sleek website, their cool app? What if you could quickly find the answers to your medical need and instantly have access to quality services whenever you need it, all in one place? Telenurse aims to make it easier and straightforward for visitors to get help and advice from professionals when they need it, from the comfort of their own home. It's free to all visitors, and service providers are selected by professional nurses with extensive years of healthcare experience. Connect with a Nurse feature allows patients to interact with nurse specialists from their laptop, iPad, or phone without having to leave home. Advanced nurse practitioners, clinical nurse specialists, midwives can provide consultations on women's health services, prenatal care, education, mental health counseling, wound management, chronic illness management, cardiology, mental health, dermatology, pediatrics, and community health. Patients can search for these clinical providers nationwide based on their location and preference. The site allows you to navigate to the health organization's homepage and schedule a remote consultation using internet video chats or mobile devices. The community service feature allows visitors to search for health and wellness classes, lectures, support groups, and preventative care within your state or county. Our fundamental goal is to promote health by ensuring that patients with acute and chronic conditions have access to quality care and preventative services.
Telenursing, a subspecialty of nursing, has been in existence for many years. With the advent of technology, the use of phone, internet, and other media has been a major tool in communication between the diverse clients and the nurses. We are not just interested in specific technology, but the principle of empowering the client to control and monitor their own health and bringing the idea of client-centered, more revolutionized healthcare system. We hasten the compliance and responses to treatment plans even after his hospital stay. We give advices regarding their health and wellness. We make connection where there's a great difference. And we augment the services of Davao Doctors Hospital.